What to expect from CF newborn screening results? What can you expect from cystic fibrosis newborn screening results? This important test is done shortly after your baby is born to identify if they may have cystic fibrosis, also known as CF. The screening primarily involves a blood test that measures a protein called immunoreactive trypsinogen, or IRT. This protein is produced by the pancreas and is often elevated in infants with CF. In some cases, if the IRT level is high, genetic testing for common mutations in the CFTR gene may also be performed. If your baby's screening results show a normal IRT level and no concerning genetic changes, it usually means that cystic fibrosis is unlikely. However, it is essential to know that a normal result does not completely rule out CF. False negatives can happen, especially if the blood sample is collected too early or if there are specific conditions like meconium ileus. On the other hand, if the IRT level is high, the next step typically involves genetic testing. If only one mutation in the CFTR gene is found, this indicates that your baby may be a carrier of the condition but does not confirm that they have CF. If 2 or more mutations are detected, it is more likely that your baby has cystic fibrosis, and further diagnostic tests, such as a sweat chloride test, will be recommended to confirm the diagnosis. It is crucial to understand that a positive newborn screening result is not a definitive diagnosis. It serves as a prompt for follow-up testing. Many infants who have a positive screen do not actually have cystic fibrosis. These are known as false positives, which can occur for various reasons, including carrier status or other health conditions. After an abnormal screening result, prompt follow-up is essential. Confirmatory testing, like the sweat test, measures the salt concentration in sweat, which is typically elevated in cystic fibrosis. Genetic testing may also be repeated or expanded to gather more information. Families should expect clear communication from healthcare providers regarding the meaning of the screening results, the need for further testing, and the implications for their child's health. While the initial screening may cause anxiety, it is a valuable tool for early detection and management of cystic fibrosis. To summarize, cystic fibrosis newborn screening results can be categorized as follows. A normal result indicates that cystic fibrosis is unlikely but not completely ruled out. An elevated IRT level with one CFTR mutation suggests possible carrier status, and further testing is needed. And an elevated IRT level with 2 or more CFTR mutations indicates a likely diagnosis of cystic fibrosis, requiring confirmatory testing. Remember, false positives and false negatives can occur, making follow-up testing and clinical evaluation essential. Early diagnosis and treatment following newborn screening can significantly improve health outcomes for children with cystic fibrosis. Always consult healthcare professionals for personalized medical advice and support.